Good afternoon and welcome everyone to Stony Brook University Hospital Blood Bank's live stream discussion, Never Stop Giving, a conversation about blood donation. I am Doreen Cestare, your moderator for today's program. I am a registered nurse and a certified hemopheresis practitioner. And currently I am the nursing administrator for the blood bank donor and apheresis departments. I have been with Stony Brook University Hospital for 34 years and been in my current department for approximately 28 years. It is my pleasure to be spending the next 45 minutes to 1 hour with you discussing how our country is facing a national blood crisis, the worst blood shortage in over a decade. We will be joined by a panel of experts as we discuss the importance of blood and platelet donation and answer commonly asked questions about giving blood and platelets, and particularly in the midst of the COVID-19 pandemic. We realize that you might have some questions pertaining to this information, and we do ask you to join on the broadcast by commenting your questions, and we will try to get to as many of them as we can. It is my pleasure to introduce our panel of experts. First is our blood bank medical director, Dr. Linda Mamone.
Hi, Doreen.
Hi.
Thank you for introducing me. I'm excited to be here and talk about this important topic with everyone. And just to give you a little bit of background about myself, I did my pathology residency training and then did a transfusion medicine fellowship before coming to Stony Brook University Hospital in 2019.
Thank you, Linda. Next is our Associate Medical Director, Dr. Tahmeena Ahmed.
Hi, everyone, and thank you so much for joining us for this very important conversation about blood, Never Stop Giving. I'm one of the Associate Medical Directors. We have four people in the blood bank, 4 physicians in the blood bank who are doing transfusion medicine. I'm one of them. I am also trained in hematopathology, and we are going to be having a very interesting discussion. So thank you very much for joining us. I've been, I trained in pathology as well, and trained in transfusion medicine and hematopathology.
Thank you, Tahmeena. Finally is our nursing clinician, Melissa Denburg.
Hi, everyone. Thank you so much for joining us today. My name is Melissa Denburg, and I am a certified apheresis registered nurse in the blood bank at Stony Brook University Hospital. I've been a nurse for the past 17 years. In the first 11 years, I spent as a pediatric intensive care nurse, and in the past 6 years, I've worked in the blood bank. I am so excited to be here today with my colleagues and friends to discuss and share our knowledge about the current blood shortage and ways that you can give so that we can emerge from this stronger, better educated, and more prepared than before. Thank you.
Thank you, Melissa. We're so excited to have all of you here. Let me first start off by asking Dr. Mamone, why are blood donations so important?
Sure, I can start us off with that one. So the short answer is that all day long, patients are transfused with blood and blood products. Here at Stony Brook University Hospital, we transfuse approximately 25,000 blood components each year. Another estimate from the American Red Cross is that every 2 seconds, someone will need blood. So if you stop and think about that estimate, it's pretty staggering. And I was just going to take you through a couple of the groups of patients and the scenarios that might require blood. So the first group I was going to mention is your trauma and your accident patients. So these patients may not only need one transfusion, but also multiple transfusions and different product types, such as red blood cells, plasma, platelets. Another group of patients I'd like to highlight is certain cancer and transplant patients. For instance, cancer center patients may be coming a few times a week to have their blood counts monitored, and if certain parameters fall below a certain threshold, then they may need to be transfused. Another group I would mention would be patients with sickle cell disease. and other hemoglobin disorders. And again, these patients are often not just transfused once. It's generally a chronic, have acute crises and other events that require more than one transfusion. And I was also going to just add a little bit, if I can, about how the COVID pandemic has impacted the blood supply. So early on, at the very beginning of this pandemic, we weren't really sure if COVID-19 patients would be more likely to bleed than other patients. We were relieved to see that wasn't true. Of course, COVID-19 patients can be affected with other conditions that can cause bleeding either directly or indirectly. But the demand really didn't change. Again, there's slight fluctuations, but many of those patients that I described and others have a continuous need for transfusion. However, I was talking a little bit about the demand, which is kind of more or less static, but however, the supply has been impacted by the COVID-19 pandemic. And I was just going to give you a few examples. For instance, potential donors may be sick themselves. They may be afraid to come to certain types of places. And also, we've seen a lot of the blood drives being canceled. And again, we saw this with Omicron, unfortunately. So, so it's always a good time to donate or think about donating.
Great. Thank you, Dr. Mamone. As we can see, blood is critical to support many patient populations. Dr. Ahmed, Dr. Mamone mentioned different blood products. Can you explain the differences between these blood products?
Yes, of course. Thank you, Doreen. So all of our blood products are derived from blood donors. It's derived, our donors come in out of their altruism, the kindness of their hearts, and come and donate. And we collect various different components from them. So blood essentially is made up of the cellular parts, the cells, your red cells, your white cells, your platelets, and the liquid part of the blood, the plasma. So we have two types of donation. One is called whole blood donation, which is essentially the blood that flows in your veins. The donor comes in, and if they're eligible, we take a unit of blood or a pint of blood. So the average person has about 5 liters of blood circulating. This is dependent on the weight. So the larger you are, the more blood you have, and also on the gender. Men have more blood than women. About 10 pints of blood is available. So we're only taking off about 8 to 10% of the total blood volume, and it's a safe volume to take off. Now, with whole blood donation, as I said, we can separate the whole blood once it's taken into the red cell components, and red cell that is donated, red cells are good for 42 days. The whole blood also has platelets in them, and we usually at Stony Brook Hospital, we collect platelets by a separate process, which Melissa will take you through, my colleagues will take you through, but platelets are small cells that help the blood to clot. So they, as Dr. Mamone was saying, we have patients who are at risk of bleeding. Platelets are very important to control this. Platelets are only good for 5 days. We can also collect plasma, and plasma can be frozen and kept for a year. So we have various types of components that we can collect. The white cell is collecting white cells is a special type of collection called granulocyte transfusion, and we really do not do that at Stony Brook, but we collect whole blood and we collect platelets and red cells. Now, the body has an amazing ability to replace what you've given. The plasma, the fluid, the liquid part of the blood, the plasma is replaced in 24 hours. Your bone marrow is amazing at making red cells, so you make about 2 million red cells a second. About 1 million platelets a second. So the red cell volume and the platelet volume comes back to normal within a week to a few weeks. The blood type that we transfuse patients, we have to know your blood type. So essentially, there are 4 blood types, depending on whether you have certain proteins that are present on your red cells. These are known as antigens. So you can either have A antigen and you will be blood type A. You can have B antigen on your red cells and you'll be blood type B. You can have neither one of them, so you'll be blood type O, or you can have both of them and you'll be blood type AB. We also have another protein called the Rh factor, which is either present or absent. So you are either, for instance, if the Rh factor is present, you're A positive or A negative, B positive, B negative, O positive, O negative, or AB positive and AB negative. This is blood type is passed from your father and your mom. So you basically are depending on your parents' blood type. That's the blood type that you're going to have. And you can also find out your blood type after you donate, either by calling the donor room, or you can find it out on your donor portal, which is available. This information is available. So what types of blood types are more common? Well, O positive is the most common blood type, is 39% of the population, followed by A positive, which is 30% of the population. B positive is 9% of the population, and AB is only 4%. On the other hand, O negative is only 9% of the population. A negative is about 6% of the population. B negative is about 2%, and AB negative is only 1%. Now, these blood types vary depending also because you get them from your mom and your dad, you get them genetically, so they vary in different diverse populations may have different blood types. However, we have certain blood types that are very, very crucial for blood bank functioning, for giving to patients. This one of the blood types that is very, all blood types are very important, and we encourage everybody with all blood types to give. But if you are an O negative patient, O negative donor, you are what we call a universal donor, meaning that your blood type is acceptable to everybody. So we are a major trauma center here. We have people coming in after severe accidents or something catastrophic. There may not be time to type the blood, so everybody can get O negative. This is why universal donor types especially are a very precious blood group, and we like to encourage these people to donate. That doesn't mean we need all blood types, to be honest. We need every single blood type that we can get because we have a very diverse patient population. Type AB is also very special. Now, type AB is what we call universal recipient for red cells, meaning that if you are type AB, you can accept blood type O, you can accept blood type A, you can accept blood type B or AB, and this is good because this is you can get any blood type and there wouldn't be a problem. However, for platelet donation and plasma donation, AB is also very precious to us because they have the type of platelets that are acceptable to a lot of the population. So they are a universal donor for the platelets and plasma. So this is why we encourage type AB people particularly, but also everybody to please come and donate platelets. Platelets only last for 5 days, so they're really very crucial for functioning of any hospital, particularly Stony Brook Hospital has cancer center. We are a major trauma center. We have a big cardiovascular unit. We have a burn unit. We require a lot of platelets and plasma in addition to red cells. Blood, and I just want to remind us also that all the blood and platelets donated at Stony Brook Hospital in our blood bank is placed for our patient needs. It's transfused to our patients. It stays local for our patients' needs. It's an excellent way to give back to the community. And as I mentioned again, there is no substitute for blood. A unit of blood that's donated or platelet or blood product that's donated really is donated out of the kindness and the altruism of our donors. And there's no, this may be the one thing that saves somebody's life. So please, if you can, never stop giving. Thank you.
Thank you, Tahmeena. While you were saying that the interesting information, we did get a question that came through from Dr. Bushra. What will happen to my blood levels after donating?
Thank you very much for that question. So as I mentioned, your blood levels do go down a little bit after donating, but they are made up very quickly. The bone marrow is very active and makes up the red cells very fast, but it takes about six to 8 weeks to recover your hemoglobin levels. This is why we ask you to wait 6 to 8 weeks between donations. The plasma is made up in 24 hours, and we also want to remind our donors to please be well hydrated and drink fluids after donation. The platelets are made up in a few weeks, and you can come and donate platelets. As Melissa will tell you, you can come and donate platelets once a week. So your blood levels bounce back really quickly after donation.
Thank you, Tahmeena. Dr. Ahmed, thank you so much. It's very interesting. Melissa, would you be able to tell everyone where and how people can donate these life-saving products?
Sure. Thanks, Doreen, for the question. So, it seems as though these days it's been a little bit more difficult for us to figure out where really blood donation centers and blood donations are taking place. Due to the pandemic, a lot of our community drives had been canceled. So fortunately, there are still some places that are collecting blood. And I think we've seen recently that even some of the local drives are starting to pop up again. So Stony Brook and other local donation centers have been collecting blood since the start of the pandemic and are still collecting blood, of course. And I think many people may not realize that we have a donation center here at Stony Brook. And we are located right on the main level of the hospital when you come in, level 5, right past the Starbucks and near the main elevator bank. And we're actually really fortunate to be one of the few hospitals that still maintain an active donor center. And we're really quite proud of this. It's important because in the event of a crisis or an emergency, we can call upon our local community to donate and to provide these life-saving products to our community. We're staffed by registered nurses at Stony Brook. And as Dr. Ahmed mentioned, all of the products that we collect are actually processed and transfused to a patient in our hospital. We are open 6 days a week, so we have very convenient hours. And we're open Saturdays as well. We have daytime and evening hours available. And we always encourage walk-in donors. So if you just feel like coming in one day, we encourage you to come in and do that. We always accept walk-ins. We have an online donor portal that a donor can use to schedule appointments, and we certainly encourage that. Also, you could always call to make an appointment. And it's very important to note that we do validate parking, so you will never pay to park at Stony Brook if you donate blood. So that would be the where. To answer the second part of your question, the how. So once you've decided to donate blood, I feel like the how is kind of easy. You need to be between the ages of 17 and 75 and have a valid identification with you. If you've reached your 76th birthday, you can still donate as long as you have a note from your physician signed and dated stating that it's okay for you to donate. We have many donors that are over that age, and we certainly encourage that. We ask that you haven't been ill at all in the past 10 days, including COVID. If you have a chronic health condition, we ask that you don't have any pending tests, any laboratory results pending, or any changes in your symptoms. Certain travel also may have restrictions for blood donation. So we do follow all eligibility guidelines set forth by the FDA, the AABB, and the New York State Department of Health for the safety of our blood. But so if you do have a specific question regarding your health history, your travel, we definitely encourage you to give us a call, and we would be happy to discuss any individual circumstance that you might have.
We do have a question that came in from Nancy. She would like to know, how long after you recovered from COVID can you donate?
Oh, okay, sure. Yeah. So you can donate actually after 10 days after your resolution of symptoms.
Thank you. Also, let's see, we have another question. Perhaps Dr. Mamone can take this one from Stu. He says that he has a heart condition, and I was told not sure I can donate. The issue, I take medication for left side of the heart, was not full extraction, but now with meds, I am normal. Dr. Mamone or Dr. Ahmed, do you want to comment on that?
Sure. We have various heart conditions. I mean, at Stony Brook Hospital, yes, we do encourage you to come in to donate, but our number one priority is the safety of the donor and the safety of the blood. But we mostly want to make sure so I would think for specific questions, it's probably best to call call the donor room specifically, and we can walk through that, because we still need to go through medications and exactly what type of heart problem it is. We will probably need to address this on an individual basis. So I feel like, we can't quite address this in a more public forum. But there are certain conditions that preclude donation where it would not be safe for the donor to donate. So we when you come to the blood bank and you get a physical, we take your heart rate, we take your blood pressure, and you also sort of get some advice. And we want to keep the donor as safe as possible. I mean, you're coming in to do a wonderful thing out of the kindness of your heart. We want you to be safe. So if that's okay, I would rather say, please call the blood bank and we can specifically address that question for you. Our number again is 631-444-DONATE. That's 631-444-3662. Yes, thank you.
Thank you, Dr. Ahmed. That's a very good point. We do have registered nurses here who answer the phones, and they would be happy to give you specific information if you have any questions. So thanks for bringing that out. So Melissa, if somebody isn't able to donate, is there anything else that they can do to help us out?
Oh, definitely. I absolutely love this question. So we are actually, we get approached often about those who can't donate, might have a fear of needles, or for whatever other reason they, can't donate, but they still want to get involved. So we have a lot of options. We are just getting started with a donor champion program here at Stony Brook, and we're really excited about it. I'll give a quick explanation of it. So a donor champion could also be a blood donor themselves, but is really a person who is able to rally their friends, their family, their coworkers, their neighbors, anybody to come in to donate blood for us. So we would pick a day, a couple of days, or even a week to hold a blood drive. And we'll provide flyers, checklists, important facts about blood donation, and most importantly, a very special donor champion t-shirt to wear with pride. So if this is something that interests you, we just ask that you give us a call. We would be happy to explain it to you, and we would love to get you on board with that. And again, we often get approached by teams, clubs, and other groups, especially being here at Stony Brook. A lot of our teams come in and they like to hold drives. And there are so many ways that you can get involved. We just recently had a Girl Scout troop contact us, and they were interested in getting involved, but obviously they're too young to donate. So what can they do? Well, we provided them with some information, and they made posters and they hung them around the school, and they educated their teachers, their families, and their friends regarding the importance of blood donation. It was absolutely adorable, and we thank them very much. So again, if you're part of an organization and you want to get involved and you want to spread the word and the message, we would love to help you, guide you through the process. But really, one of the easiest ways that you can get involved is to just simply spread the word and educate. Tell your friends, tell your families, spread it on social media. Social media is such a powerful tool. And for one, we have seen its impact here in the blood bank and how it can reach many diverse populations. And that would be wonderful. So we thank you for anything you can do to help spread the word regarding the importance of blood donation.
Thank you, Melissa. Those are wonderful things that the community is doing to help us out. We really appreciate that. Dr. Mamone, is there a limit to how often someone can donate these blood products at Stony Brook?
Sure. Dr. Ahmed had touched on it a little bit, but I'll just give you some general ideas of what the interval times are, provided that other eligibility criteria would be met. So for red blood cells or whole blood donations, we would ask, a single unit of red blood cells or a whole blood donation, we would want you to wait at least 8 weeks. And again, just to give your body a chance to recover, even if at 6 weeks you may be good, we would like it to be 8 weeks for donor safety. If you're donating a double unit of red blood cells, then it's 16 weeks. And if you're donating platelets, it's once a week and no more than 24 times a year. And again, like I said, and she said, we just want to do this the safest thing for the donor and of course the recipient too.
Thank you, Dr. Mamone.
Oh, and just provided that other eligibility criteria are met, of course.
Sure, of course. Thank you. Melissa, actually a question came in that I was going to ask you about from Nada. She wants to know if you can tell her more about the donation process, like how long could someone expect to take out of their schedule to donate, and what is the process like?
Sure, absolutely. Okay, so the process to donate is actually kind of easy. It takes about 45 minutes out of your day from paperwork to juice and cookies. So the first step would be you come in and you're going to fill out a form. We have a paper form, and you're going to ask simple yes or no questions regarding your current health status and your health history. At this time, we also provide you with additional blood donor information, and you always have the opportunity to ask questions if you have some questions. From there, we take you to a private interview area where, if the nurse needs to, we'll further ask some questions regarding your medical questions that were answered. Could be your travel questions, anything that we ask on the history form. From there, I do want to also mention that your private health information is always protected. Once the interview is complete, we move you to our donor area. So from there, we will assess your hemoglobin level and your vital signs. So it's kind of like a little mini physical. So I know a lot of our donors like that. If you're donating platelets, we will need to take an additional laboratory test. So once it's determined that your vital signs are within our parameters, your hemoglobin is within our parameters, the nurse prepares for your blood donation. For whole blood, the donation usually takes between 5 and 10 minutes. For platelets, it's a little bit longer. You're placed on one of our apheresis machines. The process usually takes between 1 and 2 hours. I do want to mention that we do separate. We'll take out a small volume of your whole blood. It's about a cup, and that is separated into a sterile collection kit using a machine. So each time the machine is used, a new kit is installed. So we collect your platelets and some plasma, and everything else is actually returned to you. I know it takes a little longer, but I really want to mention that a single platelet donation can potentially provide up to 3 life-saving platelet products for up to 3 patients. So we have machines to accommodate everyone. We have single needle machines and double needle machines. In addition to collecting whole blood and platelets, we also collect double red cell units using an apheresis machine. This donation is really popular for those who have a very high hemoglobin level and who might want to donate a little less frequently. So the interval between double red donations is actually 16 weeks as opposed to 8 weeks for whole blood. So in addition to that, we also have an ability to collect a red cell unit at the same time as a platelet unit using the same apheresis machine I mentioned. This process takes about the same amount of time as it would to take a platelet unit, or between 1 and 2 hours. I do want to mention that we are unique here at Stony Brook in that we also take different types of donations. So we have what's called a directed donation here. So if you have a family member or a friend that is being treated in the hospital, and if they consent, a unit of blood or platelets can be directed toward them. So we have that program. We are proud of that program. And if you need more information, just give us a call and we'd be happy to discuss that with you. So here we also accept autologous donations. So this is a donation that a person can donate in anticipation, usually of a surgery coming up. So for a future date. So often these units are collected about 1 week prior to a scheduled surgical procedure. And I just want to mention one more thing. We are so proud of our donors and we love our donors. And while we're not allowed to compensate them monetarily, we do love to offer promotional incentives. Currently, we have long sleeve t-shirts as a promotion to our donors, for our whole blood donors, and fleece blankets for our platelet donors. We offer this as a way of us saying thank you for taking the time to donate and to never stop giving. I actually have a sample. So I'll show you. This is the t-shirt and the fleece blanket. Thanks, Doreen.
Very nice. Thanks for having that t-shirt on hand. We really love that one. It's the long sleeve one too, to boot. So thank you, Melissa. Dr. Mamone, so after the blood is collected, what happens to that blood?
Sure. So it will be basically moved from the donor area to the blood bank laboratory area. And from there, our blood bank technologists will basically process the donation. For instance, a whole blood unit, they'll filter it. They may centrifuge it down and make different components out of it. Also, we screen our donors for certain tests that were certain infectious markers that we're required to. So while those tests are kind of being run, the blood bank can also do what's called an ABO and RH typing. And I know Dr. Ahmed had spoke about that a little bit before. And then ultimately, when everything kind of comes into place and it's the unit is ready, it can be labeled and then given to a patient in need.
Terrific. Thank you so much for that information. Dr. Ahmed, in light of the current COVID-19 pandemic, is there anything our donors should know about donating, especially regarding the COVID-19 vaccine?
Thank you, Doreen. Yes. So I just want to reiterate again, at Stony Brook Hospital, especially in light of the pandemic, but even at other times, donor safety is our #1 priority. So we maintain COVID precautions between donors. We have 6 feet of space between the donor chairs. We have masks and hand sanitizer available. We clean the common areas, the donor chairs and the donor room, interview room areas between donors. So we try and maintain as much as possible COVID precautions. Of course, as far as the vaccine goes, for the most part, the common vaccines that are available in the US, the Moderna, the Pfizer, BioNTech, J&J, Janssen, as well as AstraZeneca. These are all vaccines that fall under the group of inactivated or mRNA-based vaccines. What this means for us in the blood bank is that there's no deferral period. As long as you're feeling well, you can come in and donate if you've received the vaccine. However, if you don't know what type of vaccine you received, or you have received the type of vaccine called the live attenuated vaccine, which is in clinical trials, you might have read about it. It's the intranasal type. These vaccines require a 2-week deferral. So if you either don't know what vaccine you received, or it's a different type of vaccine from the ones I mentioned, again, AstraZeneca, Moderna, BioNTech, J&J, Janssen, all of those do not require any form of deferral. You can come in right away as long as you're feeling well and healthy and meet all the other criteria. Just again, if you are coming to donate and you've received the COVID vaccine or the booster, it would be helpful if you have the information at hand when you come in to donate. Again, I know somebody asked this question before, but Just on the topic of COVID infection, blood transfusion or vaccination does not transmit COVID infection. If you did get COVID infection, again, as far as the FDA guidelines, you can donate 10 days after you're symptom-free, or if you're we do not need a negative PCR to donate. If you are PCR positive but asymptomatic, you can donate 10 days after the test, as long as you have no symptoms.
Thank you, Dr. Ahmed. So just to clarify, so if I received the Johnson & Johnson, the Pfizer, or the Moderna vaccine or booster, I would be able to, as long as I'm feeling well and healthy, I would be able to donate?
Yes, you would be able to donate, exactly. It's, and also, regardless of vaccination status, currently require all donors to wear a mask that covers their nose and mouth. And we follow all current state and CDC travel recommendations for COVID, which incidentally don't require self-quarantine. So even if you travel, please come in to donate if you're feeling well and healthy.
Terrific. And the donor can come to donate without having been vaccinated. Is that correct? They can go
We
into
do
the
not
hospital.
require a vaccine for donation purposes, no.
Thank you.
Thank you.
I know we've gotten a couple of questions about that in the past and also today. Terrific. So we do have time for a few questions, and I know the audience has submitted some. So I would like to have our questions answered by our panel. Let me take a look at what we have here. I know we did get to a few. And there is a couple about being a little bit nervous about the needle stick, which is, understandable. We do have a few of them here. One is from Jessica Fleming, and she says, I have always been nervous to donate blood. Is there a nurse there to help me through the process and ease my nerves? Let's see. Melissa, you're a nurse. Would you be able to answer this?
Sure, Jessica. This is such a good question. And you know what? I have needle phobia myself. And I've donated. So what we do is we will do everything we can to ease your nerves. We suggest that you look away. Don't look when we're going to do it. We will keep you talking. We can tilt your legs back. We encourage all of our donors to definitely eat. Definitely before they come in, and to hydrate really well the days leading up to their donation. We'll talk you through it. We'll hold your hand. We've been known to sing songs, and we will absolutely get you through this donation if this is something you want to do. If it's something that you just can't get over, then there's definitely other ways that you can get involved and help spread our message of the need for blood.
Thank you. Yes, we have a real comfortable donor room. I must say so myself, and it's definitely a nice environment for somebody who's maybe a first-time donor, or are fearful of that needle stick, which quite often people are, understandably so. We have another question. This one's from Ashika, and Ashika is asking, how soon can you donate after getting an ear piercing? Let's see, Dr. Mamone, would you like to take this question?
Sure, that'd be great. Yeah. So it basically depends if it's a state-regulated tattoo parlor or not. If it's a state-regulated tattoo parlor and you meet the other eligibility criteria, then there's no deferral. If it's not, then it's actually a 3-month deferral. And actually, interestingly, the FDA just recently, well, somewhat recently, in the time of the pandemic, has actually reduced this requirement to 3 months. It used to be a year. And actually, for instance, New York State is the tattoo places here are not considered not state regulated. And not to say that they wouldn't be using probably clean needles and doing everything in a very safe manner. They don't have the the state legislation regulation, if that makes sense. So yeah. And again, of course, if other eligibility criteria are met.
Doreen, I just wanted to add here regarding the piercing. So I know Dr. Mamone mentioned the tattoos, but
Oh,
if
sorry.
someone is pierced using sterile equipment, you can donate right away. So there is no deferral period if sterile equipment is used and you get a piercing.
Great. Thanks so much for that clarification, Melissa. We do have another, I think we have time for at least another question. Let's see, from Dr. Bushra again. Thank you so much for your questions. If someone forgets when they are due to donate again, would they get any reminders? And Dr. Ahmed, would you mind answering that question?
Sure. So, Dr. Busher, thank you again. If you are a donor, we have a donor portal that's very easy to access. It's donateblood.stonybrookmedicine.edu. There we go. It's right up there. And the donor portal will certainly send you a reminder. Also, if you are, you can also schedule your donations on the donor portal, and we will call you either the night before, or a few days before, just to remind you. You'll also get an email reminder that you are due to donate, or when you come in for the donation, we can just schedule the next donation when you're there, and provided, of course, that you meet all the criteria. So, for instance, if you're a platelet donor and you come in to donate on Saturday, and it's a good time for you, it works with your schedule, you can always say, "Oh, can I come back? In a week's time. Come back in 2 weeks' time to donate again." So it's very convenient. We have email, we have a phone call, we have your portal reminders, and also you can reschedule. You can schedule the donation when you are when you're actually here. So we have 4 ways of reminding you.
Terrific. Thank you. Just looking back at the questions, I see Nada also had a second part to her question that I believe Melissa spoke to. And that was maybe Dr. Mamone, you can take this. Nada also asked, what should I do after the donation? Dr. Nada mentioned to hydrate before, but what should I do after? Do I need to limit any activities after donating?
Yeah. So after donating, you want to just kind of take it easy. You don't want to be, going to the gym, doing like strenuous exercise. Also want to try to like avoid alcohol and other things that might, dehydrate you. So those are just some general ideas. And of course, things we would do for our health overall are always a good thing. So, thank you.
Great. Thank you. We've come to the end of our presentation. We can't believe how quickly the time has passed. We'd like to thank everyone for attending and submitting their questions. We would also like to take this opportunity to thank our blood donors, past and present, who has really helped to save our patients' lives and help them in every way. And it's a wonderful, wonderful thing. If you have any questions or comments or concerns about this program or just donation in general, please don't hesitate to give us a call. The number is on your screen. It is 631-444-DONATE. And also we have that web address there for you. You can go in and actually schedule your own donation. Just remember, please, never stop giving.